This presentation is on pediatric elbow and shoulder injuries. My name is Mary Lloyd Ireland. I'm an orthopedic surgeon practicing at the University of Kentucky. This is my website that does have this and other narrated videos and PDFs of presentations that I've done, as well as publications. We also have a YouTube account at the University of Kentucky that has this and other sports medicine related video presentations. Shoulder injuries in adolescents less than age 16. There are no real epidemiologic studies. The trends for acute injuries are in football defensive players, extreme sports such as skateboarding, skydiving. This is an older study, but I think it is of interest comparing females and males. If you look at the number of injuries per participants per 100 participants, again you have to have a numerator and a denominator, and then this shows a 2-year injury rate. In this 2-year study, the top 3 sports injuries per participants: football was 82, wrestling was 75, basketball was 32, and females softball, followed by gymnastics and cross country. We need more studies and registries of youth injuries in the United States. This is a 16-year-old football athlete who had a displaced medial clavicle fracture at the level of the sternoclavicular joint. So you can see there's asymmetry. That's exactly where he hurt. Fortunately, the displacement was anterior and not posterior. This is what his x-ray looked like. So here's his displaced fracture. It's not a dislocation, it's a fracture. And then this is what that looks like. So the epiphysis stays put and the fracture is displaced. This is 1 year post-op. He does have some cosmetic deformity, but doesn't have any functional abnormality. He did not return to football. Treated non-operatively. We must rule out fractures of the proximal humerus. You can have Salter-Harris involved as this type 3 fracture. Fortunately, these will remodel and don't need to be fixed. Did you know that Nolan Ryan didn't start pitching until he was in high school? He played other positions, but didn't start pitching until he was in high school. This may lead for an elbow or shoulder that can last a long, long time, like Nolan Ryan's career. In addition to being genetically and biomechanically gifted in baseball, he didn't start too early. There can be rotational adaptations in the throwing athlete, skeletally immature. Humeral head retroversion can occur. Little leaguer's shoulder, by definition, is a proximal humerus stress fracture. They come in with diffuse shoulder pain, which is reproducible while throwing, and by clinical exam they just hurt diffusely about their shoulder. It's good to get comparison striker views. Recommendations are 4 views of the involved shoulder and a comparison striker view. This is what little leaguer's shoulder is, a proximal humerus stress fracture. You can see how much the distance here, the radial lucency in this undulating proximal humerus is compared to the other side. It's also nice to get the comparison view to talk to parents about this, and they can really see why you are treating them as you are and delay return to play until things are completely healed. This is like that distal radius growth arrest of the gymnast seen here. And that rotational adaptation, this is much like a skiffy of the hip in the shoulder, where they may have greater external rotation and less internal rotation because of the rotation that occurs with these fractures. The rotation may be more excessive if they aren't diagnosed and shut down from pitching. In a series by Bill Carson of Little Leaguer shoulder, 23 patients, the average age was 14. 19 of these 23 were pitchers. They had pain while throwing. The average duration of symptoms was almost 8 months before they were diagnosed. So early diagnosis can be very important for these individuals to prevent a significant rotational healing of this. The treatment is rest for an average of 3 months. Average follow-up in this series was 10 months, and 21 of the 23 returned to baseball. So this isn't career ending. It's probably better to have this injury than a slap tear or a partial or complete rotator cuff tear. So the bony injury is probably a better one to pick if we could pick. These are some of these Physeal and range of motion changes. This is a series of 73 youth baseball players from age 8 to 15. They had increased Physeal width on the dominant side, increased external rotation on their dominant side. And so these are these adaptations that occur. Some of these studies are done by CT scans so we can better measure the proximal humerus to the shaft. If you have a player that comes in with a Diaphyseal Humerus Fracture, think about it being pathologic. This was a 15-year-old baseball outfielder who threw the ball in from the outfield and felt his arm follow the ball to the plate, which it almost did. So here's his initial x-ray, and you can see some radiolucency here in the canal. He ended up having a asymptomatic simple cyst and basically a pathologic fracture through this. The fracture did heal uneventfully, and he went on to fill in the cyst because of the fracture. So think about that. I've seen 10 individuals with a simple cyst in their diaphysis when they had a fracture. May not be able to see it acutely. This is a 12-and-a-half-year-old, broke her wrist, and 1 week later fell on her right upper extremity when she was doing something she was told not to do, skateboarding, and she had a fracture of the humerus. You can't really see the cyst there, but think about a cyst, and then this is what her follow-up is. So she had a simple cyst that ended up eventually filling in, but it took quite some time. She was totally asymptomatic, and we did allow her to return to soccer. And then this is at 3 years where the fracture obviously healed completely and the cyst finally filled in. Prevention is the key. Pitchers are at high risk. Don't use speed guns, less showcases, do training other than baseball. Little league pitchers do not become big league pitchers. That's a quote that if you talk to little league parents and coaches will really hit home. Have them play other positions. This 13-year-old big pitcher syndrome, he's growing fast, he's mentally immature as well as skeletally, poor pitching mechanics, he'll have hip weakness, and he'll end up with a shoulder and elbow problem. And our charge as healthcare professionals taking care of young athletes is to protect them, reduce the rate of rotator cuff and UCL injuries in our young pitchers. Those little league pitchers do not become big league pitchers. This has not been written up, but in the pro baseball circles, surveys that have been done show this to be true. Let them play other positions. Don't let them pitch too early or too hard too early. There are programs that our youth can participate in for injury prevention. This program, backed by several different societies and institutions, is stopsportsinjury.org. This is an interactive site where parents and athletes can go to this site and learn about overuse injuries in different sports. This stands for Sports Trauma and Overuse Prevention. We must protect our young athletes from harm. Ulnar collateral ligament tears in youth baseball occur too often. Education of the athletes, parents, and coaches in injury prevention and injury patterns needs to be done. So which is safer? Organized sports or free play? Unfortunately, I think the answer is free play is safer. Adults or obsolete children? Dr. Seuss. This adolescent is invincible. He's a skateboarder. He broke one forearm. I told him not to skateboard. By the time I got back from a vacation, he had broken the other one, skateboarding. We must protect these young athletes from themselves, or at least try.